Thanks for attending this session. Let me introduce myself. I'm Ibrahim Salah. I will make it very short. Actually, I passed PLAB 2 exam. I managed to pass the exam with high score in all stations, so I started to share my experience through this journey. I started to share it through orientation session like this, 3 group MOOCs, paid one-to-one MOOC, crash courses, semantics teaching, procedure teaching. I started to share this experience through many ways, and I'm here today to give you my own experience in this journey, and to guide you a little bit through this journey. It will benefit you a lot. Okay, so first of all, I will try to explain everything about PLAB 2 exam from the start of your journey till the day of the exam in very quick way, and I will let you ask any question at the end of the session in order just to reduce the interruption during the session. So if anyone had any questions, just write it down, and I will answer it at the end of the session. Okay. So first of all, what is PLAB 2 exam? One of the fatal mistake and one of the most avoidable mistakes that most people start this journey without knowing what is PLAB 2 exam. And the best way to know about this exam is to go to the GMC website itself. Okay, so I will start sharing the website with you. So this is the GMC website. Just write down on Google PLAB 2 exam GMC. Okay, so you will see what is PLAB 2 exam. Okay, every single detail is here on the website. And believe me, if you stick to this explanation, you will pass this exam with high score. It is not only about passing the exam; it is to get high score in each step. And you will make your journey very easy. Okay. So first of all, what is PLAB 2 exam? From the website here, we can see this exam covers everything UK trained doctor might expect to see on the first day of foundation year 2. So let's agree that all the scenarios you will have in the exam, you will deal with it as an FY2 doctor, not FY1, not a senior, not a specialist, not a consultant. So you have to deal with the whole situation as an FY2. And also, this will solve a lot of problem in the STEM. After that, I will explain this in a minute, okay? Yeah, and it also tests your ability to apply knowledge to the care of patient, not how you can remember and recite facts, okay? So it is not an oral exam. You need to do one of the secrets of this exam, and one of the most important tricks here is to deal with the whole situation as a day in your clinic, a day in your hospital. Many of us have a specialty, or even if you are just a GB or a medical doctor who didn't take in a specialty, what you do in internship year, it is likely the same with some difference. So you need to deal with the whole situation as a day in your hospital or your clinic. So don't deal with it as an oral exam just to tell the information or something like this. Okay. All the question relate to current best practice. You should answer them in relation to published evidence and not according to your local arrangement. Because actually most of us come from different countries, and we may have different guidelines. So we need to stick to the NICE guideline or the UK guidelines. Okay, it's very important to do it in this way. And how you will gain access to these guidelines through the NICE guidelines. or through the NHS website. It will guide you a lot. Name of drugs referred to in the exam are those contained in the most recent edition of British National for the BNF book. The BNF, actually, in all station, you will have a BNF book, okay? In all station in the exam, you will have this book, but don't just because you see this book in all stations, so you will realize that you need to open this book in this station. No, it is a false belief, and also it is very avoidable mistake in the exam, because when you will enter the cubicle, I will explain this in a minute, you will see this book, so you will think I should open the book in this station. Okay, no, actually they bring it in each station in case you need to know anything about medication, but it is not important to open it on each station. Okay, so how do you answer the question? So before entering the cubicle, let me give you a quick recap about what will happen in the day of the exam itself. Mostly you will have 16 stations. Sometimes they will cancel, they may cancel some station, but this will occur after your exam. So you will have 16 stations. You will have 1.5 minutes to read each station and 8 minutes to do the station. Okay. In the day of the exam, you will go to the GMC building. Nowadays, there is 2 buildings because they opened a new one. So you will go to the GMC building maybe 30 minutes or less than that before your exam. They will give you some instruction. And the core of this instruction is that you need to read the scenario very well and to focus only on the task. Okay? And sometimes they may mention in a funny way, all of us people know this station, and this is a fact. You will enter the exam, and before entering, you will be able to know all the stations that come in the exam, because we have like a curriculum for it. But the point is, they will change the concern, or they will change the task in the exam. Okay, so don't depend on your knowledge only, or the notes, but depend on the main task in the STEM before entering the cubicle, or the main task or the main concern the patient will provide you with it. Okay, so you will know the station, but concern can be a little bit different. Even in the same day of the exam, at some time you will have a concern, and your colleague at the same day will have another concern. Okay, so be prepared for something like this. Okay, let's return back to the exam day. We have 16 stations. You will have 1.5 minutes to read the STEM before entering the cubicle. My advice to you in this critical time, actually, this time is the most important time in your career, because if you use this time in a perfect way, you will manage to pass the station. Okay, so how to use it? Read the station 1 time, 2 times, 3 times as you can, and read the task very well. Okay, one of the most avoidable mistake in this people do in the exam, actually, when they read the station, oh, this is celiac disease, this is MI. Okay, I know the station, and just sit like this. They didn't think about what they should do in this station. Just sit like this. Okay, it's very avoidable mistake, and it is common mistake, because actually in the start of each station, you may be a little bit anxious, so you may forget things. So after reading the STEM, after reading the task, start to remember the history part here, the management. At least try to remember what will be the first 5 questions you should ask in the start of the station. Okay, what you should do, first of all, you need to try to discover which station is it, and after that, what should I ask in the start of the station, because actually those 5 questions will push you forward, because you will enter the cubicle, you have a 5 question in your mind according to the station, but you have a 5 question in your mind. So you will sit and ask those five questions, and after that you will be a little bit relaxed. So your mind will have the time to manage to think about other questions. So it is the best way to do this term. Even if you didn't discover which station is it. My sound is clear, people? My sound is clear till now? I want you to confirm this. My sound is clear? Okay, good. So even if you didn't manage to discover which station is it, try to think about differentials, okay? But try to think about the most important differential. This word is not only for beginners. This is for people who had maybe exam tomorrow, okay? It's very important. This is the secrets to pass the station, because I know that a lot of people didn't manage to do this exam, and actually it is out of their hands because no one tell such things, or no one guide or say this important. Actually, it is easy information, and it is here on the website. Okay, so try to think about differential for this station. Try to prepare yourself. Maybe you will have procedure station examination, Simman station. So you need to know which station is it before entering the cubicle. Okay, coming back to the website here. How do you answer the question after reading the instruction and the patient information outside each room? You will enter the exam cubicle and complete the task outlined. There will be a timer that anonymous announces when to move on. Okay, so after reading the station, you will have 8 minutes starting from entering the cubicle. So at the start of the station, you need to look at the camera. You will have a camera in one corner of the ceiling of the exam room. So you will look to the camera and mention your name and your GMC number. Like, I'm Dr. Ibrahim, my GMC number is 1, 2, 3, 4, 5, 6. Okay, and after that, go to your chair, sit on it, and start your conversation. Okay, hello, I'm Dr. Ibrahim, one of the junior doctor here, one of the FY2 doctor here, one of the foundation here doctor here. The starting is different, and you can do it in many ways. Okay, so after that, start the data gathering part. Let's move to how you will be tested. Okay, so it is very important. I need anyone who starts this journey to print this out and to put it in his or her room. It is very important, and this is the secret to manage your time very well. And if you ask it, I'm sorry to say this harsh information, but if you ask it anyone who didn't manage to pass the exam, they will tell you the main problem is I'm not able to manage my time. Actually, I know everything, but I was not able to say everything in the exam. Okay, so let's say how this will make a difference. We have domains for the exam. The main domains for the exam is data gathering domain, technical and assessment skills, clinical management skills, and interpersonal skills. Okay, the first domain, which is data gathering domain, this is the most like how to say it. It have a very bad reputation. It is the most common domain that make people fail the exam, and also it is the most common domain that make people pass the exam. If you manage to do this domain in the exact time, you will pass this exam with high score. Okay, so data gathering domain is about collecting data from the patient, and the trick here, mostly or most commonly, you need to collect the data that you will use it during the management. Okay, actually they gave you 8 minutes to do the station. They gave you 8 minutes to do the station, but they know that this station may take up to 30 minutes or even 15 minutes to do it in the hospital. So they tell you, please be focused, ask a relevant question. Okay, so mostly you will ask people the last time anyone had any problem with voice. My voice is completely clear. Does anyone have any problem with voice? If someone told me my voice is clear, so it is clear. The problem is not from my side. So till now, my voice is clear? Okay, thank God it is not from my side. If anyone have any problem with the voice, just exit the meeting and enter back again. Okay? So coming back to here, so data gathering domain, you will start to gather data that you will use during the management part, or that will lead you to the provisional diagnosis of this station. This applies to medicine station. We'll talk about it later on. Medicine station, counseling station, ethics station, any type of, even examination station. So try to gather the data that will help you to. That's why you need to ask a relevant and logic question. Relevant and logic question. And you may know this question from the notes, and I will discuss it. So history taking is one domain from the first part, which is data gathering, physical examination, practical procedure, investigation leading to diagnosis. Okay, so one of the most common misconception is that data gathering part or data gathering domain is only history taking. Actually, you do this practical procedure, or you do examination, or you do investigation in order to do the data gathering, in order to gather data from the patient. So all of this is a part of data gathering, and this domain equal 4 marks in the exam. Okay, and this domain equal 4 marks in the exam, and this domain equal 4 marks in the exam. So 4 marks for each domain. Okay, so one of the most avoidable mistake is that most people consume like, oh my God, 6 minutes to gather data only. No, 6 minutes to take history only. It is a fatal mistake, even if it is like a medicine station, or it is a first presentation for the patient. If you, I usually say this during the mock, in most stations, if you talk history for 6 minutes, I'm afraid you may not be able to manage to pass the station. So it is important to manage your time. Okay, in case you talk history in 6 minutes, try to control your time during the management part. Okay, but my advice is to just divide the time on this 3 domains. Actually, you don't have to give time to the interpersonal skills, because it will be a part of the data gathering domain and clinical management. Okay, so history taking, physical examination, practical procedure, if you need to do some practical procedure in combined station, investigation leading to the diagnosis, all of this is a part of data gathering. Okay, I will give you, for the beginner, I will give you an advanced information, but let me say it. Investigation leading to the diagnosis. So it is better to mention the investigation before telling the provisional diagnosis, or at least the initial investigation. Okay, so after taking history from the patient, okay, thank the patient, and now you are about to examine the patient. Okay, so after examining the patient, mention, or before even examination, mention this: I need to examine you and do 1, 2, 3, and I need to send for some initial investigation, which is 1, 2, 3, because in many scenarios you will take history in a very good way, but this history will lead you to a different diagnosis, and after doing the initial investigation, the patient will give you a paper with the result of this investigation, and this investigation will correct your diagnosis. I hope that you got my point here. So doing initial investigation will help you in many scenarios, or to correct your wrong diagnosis about this scenario. So I would do initial investigation before mentioning the provisional diagnosis in the scenario. Okay. The second domain here is clinical management skill. So you need to give a patient diagnosis, but don't be 100% sure, because actually you are FY2 and you didn't do enough confirmatory test to do it is 100% MI like this, or it is 100% rheumatoid arthritis. You didn't do enough examination and enough investigation, and also you are on the exam sitting. Okay, so the investigation or the confirmatory test is very limited. So I'm suspecting, and we will confirm it by doing 1, 2, 3. There is some exception. We will talk about it later on. Okay, and one of the secrets to get high score is to explain to the patient about everything, and most people do this in a different way. Like if you are about to tell the patient you have like you have intussusception or pyloric stenosis, your child have pyloric stenosis. Have you ever heard about it? From where should I hear about it? I didn't do medical school. Okay, so this is not the good way to do it. Explain to the patient in a simple way, and I would prefer to explain the condition in a simple way, and after that to mention the medical jargon to the patient. Like if I'm telling the patient you have carpal tunnel syndrome, I would say it in the exam setting. You have a condition, like you mentioned to me that you have pain here in the wrist, and you feel at some time tingling or electric sensation in your hand. So I'm suspecting it is because of compression of the nerve at this area, which is called carpal tunnel syndrome. Believe me, you will get the mark for the provisional diagnosis, full mark for provisional diagnosis. You need to explain things in a simple way to the patient, okay? And don't depend that the patient know everything. Yeah, he is trained to know everything, but he will pretend that he doesn't know everything, okay? So explain things in a better way. Don't complicate things. And one of the most avoidable mistake too, I'm trying to focus on the important point, because as I mentioned, all the information you need to know about PLAB 2 is spread everywhere. You can access it, but this point is important to focus on it. Assume that you took history on 6 minutes in the exam, okay? And now you have only 2 minutes. You will hear a voice after 6 minutes. Okay, you have only 2 minutes. So at this point, you need to stop data gathering and start management. Actually, they do this bill to tell you to stop data gathering and start your management. Okay, assume the worst case scenario is that you have 2 minutes to finish the provisional diagnosis, the management part, the follow-up part, or the safety netting part, and I will talk about all this in a minute. Okay, so we have like 5 tasks to do on those 2 minutes. It is irrelevant at all people to consume 1.5 minutes explaining to the patient about his provisional diagnosis. Do it in a very simple way, in a very simple short way, because you have 2 minutes to gain like 7 marks. It is irrelevant to consume 1.5 minutes from those 2 minutes just telling her she had carpal tunnel syndrome. Okay, so try to use simple words, short words that will. I don't mean you don't tell the patient about the diagnosis. Actually, it is his or her full right to know the diagnosis, but do it in a simple way. Think about marks in the exam. Okay. After that, you may do management part, and I need you to be clear on this point. Like, after mentioning the provisional diagnosis, start to mention what will you do to confirm this provisional diagnosis, okay? And what should you do next? Don't just wait for the patient to tell you what you will do next, doctor. Just mention it, okay? We need to admit you. We will give you treatment. You will be discharged. We need to refer you to the like a specialist or to another clinic, ABCD clinic. Okay, so be clear on the next step. What will you do? Okay, because actually at the worst case scenario, and you have like 10 seconds to mention the management, and if you said admission, so it is important, like half of the management. Okay, referral is like half of the management. So try to mention the next step in very clear way. Okay, and be a caring doctor. Like what? If your patient is coming because of pain, so the first thing to give the patient is painkiller. If there is no other risk or no serious condition. If your patient have a serious condition, see what will kill the patient first, what will cause blindness first, what will cause a heart attack first, what will cause stroke first, and treat it. Okay, this will increase not only the management part but your IBS. Okay, so it shows that you are a caring and you are a safe doctor. Okay, and at some point you may need to give some lifestyle modification. So we have medical part, we need to give medical management and lifestyle management. Lifestyle management is different from case to case. It could be referral to specific clinic, to referral to dietitian. It could be leaflet contain the advices. So don't forget to say about it. And in some station, you will do safety netting. Like the patient came to the clinic because of serious condition, and he will be discharged home. So you need to safety net him about this serious condition. How to safety net him? Mention to him the serious symptom that he may discover or he may notice. And if he had this serious symptom, to come to the hospital directly or to call the ambulance to do an immediate act. Okay, so it is important to safety net patient in many stations, but in a lot of stations you don't need safety net the patient because there is no safety netting. So try not to invent safety netting, okay, because it will be irrelevant. Okay, so you will notice this during your study. Sometimes if you had like a simple condition and you excluded the serious differential diagnosis in this station, yes, you need to safety net the patient. Like if the patient is coming to you with chest pain due to trauma or like costochondritis, okay, so safety net him about the red flag here, which could be heart attack, which could be MI, give him the symptom of heart attack if he noticed to come back to the hospital. It's very important. Okay, the interpersonal skill part at some point, and the management may need to do follow-up, and also you will do follow-up in a specific situation. Okay, the interpersonal skills part starts with you from the start of the station till the end. Okay, and what is this part? How you approach the station, whether you establish the rapport with the patient, how you use open and closed question involving the patient and demonstrating your professionalism and understanding of the ethical principles. Actually, it is very important part, and you will do this or you will gain this information by doing practice, by knowing about the ethics in the hospital, by being professional, by being caring doctor, safe doctor, by teaching like explaining to the patient in a simple way, by involving the patient, as I told you in the start of the session. It is not an oral exam. You didn't came to me in the exam day to just to tell me this medical information. I can read it from any website or any book. I need you to involve me, to explain things to me, to gain information in a good way, because you will be tested how you will deal with the reluctant patient. A patient doesn't need to open up for you. How you will make it open up for you and tell you the information. Like a patient refusing the treatment, how you will inform him about the importance of this treatment, and you will convince him to do it. Like I will give you an example. If I'm about to convince someone about treatment or to stay in the hospital, I can do it in two ways. The first one, someone will tell him, will scare him. Actually, if you leave the hospital, you will die. And another one can explain to them, if you stayed at the hospital, you will be treated very fast and you will go very quick. Actually, you are in the middle of the war. You finished like 5 days from the antibiotic. It is only 3 days. So what do you think? Let's try. Okay. So it is 2 ways here, and that's why people in the exam are completely different in their IBS marks in the exam. You can see someone have the full marks in this IBS, because actually it is not a medical part, it is not a medical information, but it is an approach. And because all of us, as I mentioned, we came from different countries with different cultures, and also we have different personalities. So one of the most important parts in this way is to learn how to stick to the IBS rules of the exam. Okay, how to express yourself in English. Okay, how to know about social life. I don't need you to go and live in UK like 2 years before doing the exam, but at least the situation you had in your notes. We have many ethical situation. It doesn't contain any medical information, so you need to know about this ethical information very well, like searching for this ethical information on the NHS, on the NICE guideline. So you will have the ability to tell some information from the social life in UK. It is not a medical part. You will have the ability to address the patient concern. Okay, and also by doing a practice with different people from different culture, from different academies, from different notes, it will make a big difference for you, and you will start to collect a very good IBS background. Okay, so this is the 3 domains of the exam. You need to put these 3 domains in front of your eye from the start. You need to manage your time from the start. Okay, yes, it will be very difficult in the start, but with doing it again and again and again, you will be able to do it. Okay. When marking against the domain, the examiner will assess your competency across a number of skill areas, like the clinical examination. Most of the station will involve a simulated patient. Okay, you would interact with the actor as would a real patient. Okay, so he is an actor, but you need to interact with him with a real patient, because they are very skilled actors. Okay, including requesting to perform any relevant clinical examination. Yes, he is an actor, but I need to do an examination, I will do it. Actually, starting from the COVID pandemic, examination on a real person, yeah, didn't come in the exam. You will do any relevant examination on a mannequin. So you will mention this to the patient. And also because of this pandemic, excluded many examination. It is good, actually. Yeah, many examination and many procedure from the exam. Okay, so you should begin each station by confirming your name and GMC number. This is important, as the examiner may not be present in the room and will be watching. Okay, this is a good point to comment on it. How you will be assessed. The role player and the examiner. At some station, you will have the examiner with you in the room, and in other station, the examiner will watch you through the camera. Okay, so he will need to know your GMC number and your name. So in all stations, mention your name and your GMC number, but don't care about the camera. Don't look to the camera at all. Interact with the role player. Okay, in some rooms, you will find the telephone or video call station. Nowadays, they bring in the new building, they start to bring this video call station. The call will be connected for you before you enter the room. Okay, it's important. You don't touch the phone, as they may disconnect your call. Okay, so the phone will be on a speaker mode, so you will not touch anything. And actually nowadays they may bring up to 5 or 6 telephone consultation, and it can come as any type of scenario. Medicine station, counseling, ethics, any type of scenario. They even, as I mentioned, bring medicine station. Recently, they bring a suspected case of subarachnoid hemorrhage over the telephone. So be prepared for something like this. Okay, people? And don't touch anything. But my point here, if you find any difficulty, to hear the voice, just ask him to raise up his voice, or to say it again, to repeat it again. It is very important to mention this, because I'm sorry to say, many people fail this station because of this technical issue. They didn't mention about it to the role player over the telephone or to the examiner. And I know someone who did this station again because he mentioned to them. Actually, if you mention, they have seen you through the camera. Okay, so they will know. He mentioned to them, I didn't hear the patient during the first 3 minutes of the station, so they let him do the station again after other candidates. So don't hesitate to ask him to repeat again and again and again to loud the voice, no problem. And in some station, you will be assessed in your ability to conduct a physical examination using a model or a mannequin. Okay, so this also present in the station. So it is a procedure, and I will tell you some important and good news at the end of this station. It is important to memorize 2 types of station very well, because most commonly you will have it in your exam, which is Simman station, and I will talk about it in details, and also procedure, because actually most people have one Simman in their exam. Sometimes the Simman may have some problem, because it is like a automated computerized mannequin. So sometimes it could show some problem, but it is rare. So they cancel this station from ESA exam. But most commonly you will have Simman station, Simman or Simmoman. And most commonly you will have procedure. Sometimes you may have 2 procedures in your exam. Okay, like me, I had 2 procedures. I had blood culture and taking cervical sample, smear test. Okay, so you may have 2 procedures in your exam. So it is important stations. And actually, it is easy station, because the number of Simman scenarios you had in the PLAB 2 curriculum, they are many, but they bring only like 6 or 7 Simman station. You will have 1 of them in the exam. So studying 6 station to get 1, it is very important. And about procedure, there are 7 or 8 station. So you will study them to have 1 or 2. So it is important. Unlike medicine station, you may study like 180 station to get 1 or 2 in the exam. Okay, so I hope you got my point. We expect you to be able to carry out any basic physical examination, including but not limited to examination of the abdomen, breast, and hand, heart, and joint. You may be able to perform a rectal bimanual vaginal examination. You must also be able to use the appropriate equipment carrying out an examination of the ear or nervous system. Okay, actually, there is a little bit difference between the shape of equipments in UK and other countries. So you need to make yourself familiar with the shape of this instruments. It is very important. Okay, and I will talk about this aspect in detail. I know that a lot of people have question about it. You may be required what the station that okay. I prefer to leave the question at the end of the station. It would be better in order to give you all the information I know, and I will answer all your questions. But regarding to this question, the procedure, the procedure part, and the exam, the Simman part. Okay, so you need to memorize this 2 station very well, because as I mentioned, you will have 1 Simman station in your exam, or 1 Simmoman, and a procedure, 1 procedure, or maybe 2 procedure, which is examination station. Maybe you may be required to perform examination on or other procedure on a high fidelity simulator, which can be programmed to show, as we mentioned, Simman, programmed to show normal and abnormal clinical sign. a role player may speak from outside the room using microphone connected to the simulator. Okay, so this man, yeah, it is a mannequin, but it will give you reactions. But this reaction is a little bit limited. So he can give you changes in the voice, like chest, long sound, heart. He will respond to pain. He will speak to you, but like skin rash, he may not exhibit it. Pathologists from outside, he will not exhibit it. So it is limited, but they will lead you. They may like print a photo of rash and put it on the chest of the patient, or they will put some powder, a colored powder, to tell you there is a change in the color of this part of the body. Okay, so try to put this into your consideration, because you may tell yourself, maybe someone didn't clean the cement. No. Actually, they did this to give you a clue to something. Okay, so you need to know these tricks before entering the exam. You may be required, as we mentioned. Okay, the practical skill: checking blood pressure, performing vein puncture, inserting cannula, calculating the drug dosage, giving intravenous injection. All of this, we may need to do like small sessions for it, but it is very easy. Okay, mixing injection, giving intramuscular and subcutaneous, basic cardiopulmonary resuscitation, suturing. Okay, most of this practical skills don't come recently on the exam. Okay, they bring a limited number, as I mentioned, because of the pandemic. Okay, so you will be lucky if you manage to have exam during the pandemic. Taking a cervical screen is very important. Safe disposal of sharps. Actually, it is a part of many procedure, and it is the most important part of this procedure. About the IBS part, this test skills by observing the interaction between you and another person, and usually a simulated patient or occasionally the examiner, because at some station you will explain to the role player, and at the end of the station you will go and explain things to the examiner. But nowadays also it is very limited, and it is limited to cement station and some procedure station. Okay, as I mentioned, they try to minimize the number of people in each room because of the pandemic. Okay, but before, like maybe 1.5 years before, you may have examiner in many stations in the exam, and at 6-minute bell you will go and speak to the examiner, and the examiner will assess your approach to the patient throughout the examination, even they are not present in the room, through the camera. This may include explaining diagnosis, investigation, involving the patient in decision making, communication with the patient, communication with the healthcare professional. Okay, so one of the main tasks for PLAB 2 exam, how to deal with your colleagues in the hospital, which include, let me tell you, starting from nurse, medical student, FY1, FY2, senior, consultant. Okay, but nowadays they don't bring senior and consultant, so you will have to know how to deal with FY2 colleague, FY1 medical student, and the nurse. For people, you need to know the approach on how to, and actually it is a fixed approach, but it will have some little bit difference from station to station. Also, breaking bad news, it is one of the skills, and it is one of the important skills actually in the exam, because you may have a station of breaking bad news, or you may have a medicine station and you will do breaking bad news. It could come as a part of the station. Okay, so breaking bad news is just saying how to say the bad news, and in such type of station, IBS have a very important role. Or even seeking informed consent clarification for an invasive procedure, or obtaining a consent for post-mortem. You are FY2, So in the this is what occurs in the hospital. The specialist will not come and tell the patient about the bad news. They will let you tell her. The specialist will not come and tell the patient about the severity of the procedure until she asks. Okay, so they will let you tell her. Okay, so at some point you may need to take consent from a patient to do some procedure, to do invasive procedure, and before taking this consent, you may need to explain everything in a clear way. Okay, and don't tell yourself I'm in exam situation, so no need to explain everything. Actually, you are in exam situation, but the examiner is not in exam situation. He is here to comment and to notice your performance. Why you need to clarify everything to the patient? Because in the future, she may come and complain and file a complaint against you. She may come and tell, actually, this doctor didn't tell me about this side effect. I'm not happy. I'm not satisfied. So you need to clarify everything to the patient in order to gain a consent. Even before taking a consent, and we will give example in the coming days about this, you need to ask her, do you have any other concerns in your mind I should address it? No, doctor. Okay. So are you okay to go for this procedure? Yeah, I'm okay. So I will arrange it for you. This is the best way to take consent from the patient. Okay. Don't speak to the model as you want to gain any. Okay, this is very important point here. One of the IBS part is also how to deal with anxious patient or relative. You may have angry patient at the exam or angry relative. He's not satisfied about the medical care. Please forget about your personality and forget about everything outside the exam or outside dealing with this angry patient. Start apology. And let me tell you, one of the nice guidelines is that apology doesn't mean you admit there is a medical error. If this patient is angry, just support him by apology. And if you apologize for him, it doesn't mean you admit there is a medical error. Okay, it is rule here. He will not come in the future and tell the patient said sorry to me, so there was a medical error. No, it is not the rule here. Okay, so you need to know how to deal with angry patient or angry relative, maybe angry mother, angry father, angry son. This station come a lot in the exam. Giving instruction on discharge from the hospital, giving advice on lifestyle, health. Actually, people, this is your task as an FY2 in the hospital. That's why if you manage to pass this exam, you will be able to work on the NHS and you will find this point on the hospital. Okay, so it is your main task. Actually, it is very reliable exam, but you just need how to deal with it. As we may use anatomical model in some station, it is important to remember, because such a situation seem very hilarious to the examiner. Okay, don't speak to the model as you want to gain any marks for doing so. Like if you were asked to take a blood sample from the model, in the same cubicle, you will have role player sitting in one corner of the room, and you will explain everything to him, and you will do the procedure on the mannequin, but you will notice or watch the facial expression of the role player, not the mannequin, because it is a doesn't speak. So don't tell her, okay, do you feel pain? No. Do you feel pain? Sharp scratches coming. I will introduce the speculum. I will remove the cannula. So you need to tell this to the role player and to watch any changes. And actually, they will give you, if you forgot to tell the patient, the role player, I mean, about sharp scratch, he may, like this in the exam. Okay, so involve the role player. Tell the examiner what are you doing and why only if the instruction tell you to. Okay, this is one of the most important part, because many doctors know very well how to do the procedure, but they fail it. Why? Because they didn't verbalize the step. Okay, and actually you may have also examiner at the same room, or the examiner is watching you through the camera, so he will not be able to understand the every step, or he may not be able to watch every step, so he may need you to verbalize each step. Okay, and actually you need to verbalize it because you have a role player here. Okay, it's very important to do so. Don't perform any action on an anatomical model that would be unsafe or painful for a reader. Okay, and one of the avoidable mistake also here is many doctor may be little bit aggressive with the mannequin, because in my mind I know it is a mannequin, so he will not feel pain. So if I'm introducing a speculum, I may introduce it in a very aggressive way. No, even if there is any problem with the mannequin, you need to mention it. If you are not able to manage to introduce this speculum, mention it. I can manage. I think there is something preventing me from introducing it, or I can manage to take a blood sample. I tried 2 times. I need to involve my senior. Okay, so deal with the mannequin as he is a real, because actually in the real setting it will be a real person, but because we are in the exam setting, it is a mannequin. Okay, so this is about the what how you will be tested. PLAB 2 test date, I will not talk about this aspect because you will find a lot of information about it on the PLAB 2 groups, or they usually announce on the PLAB 2 GMC website. Okay, how to book? Also, there is a lot of video will guide you how to book PLAB 2 exam, and it is from here, from the PLAB 2 GMC website, and all of this is actually a technical issue. You will be able to manage it. Okay, so what is the topic for PLAB 2? We have many topics for PLAB 2. I will just tell you the common one, or I will tell it on the way you may find it in the notes. Okay, we have like medicine station, the body organs medicine station. In this medicine station, we may have cardiology, heart problem, lung problem, tummy problem, leg problem, joint problem, skin problem. Okay, so all chapters. We have surgery, we have OBG, pediatrics, and we have also ethics, which contain many on medical situation. Like as I mentioned, dealing with a colleague, dealing with a nurse, dealing with an angry patient, dealing with reluctant patient, dealing with a relative. We have psychiatry. Okay, we have we have Simman station in the exam. So this is nearly all the station will be tested. Most commonly in the exam, you may have 1 or 2 breaking bad news. You may have counseling station, and this counseling could be counseling. What's the meaning of counseling? Most commonly, it will not be the first presentation of the patient. Okay, in counseling station, it will not be the first presentation of the patient. So put this into your consideration. Put this in front of your eye. It is not the first presentation of the patient. How to apply to this rule? Don't take a detailed history about everything, because he came before, and you may be the one who met him before. So you don't need to take all detailed history from the start. Just let him give you a quick recap and take history that will be related to the result you have, the result you will discuss today with the patient. Take history that will, because nowadays they bring maybe 5 or 6 counseling station in the exam. Okay, so take a focused history, not a detailed one, and you may have counseling about test result. The patient did a test 2 weeks ago and they came today to know about the result of his test or her test. Could be face-to-face or over the telephone. Put this into consideration. About medication, side effect of medication. About diagnosis have been made recently. Okay. About many things. Okay. But most commonly, it will not be a first presentation for the patient. Okay. Also, you may have prescription writing. So you have a scenario, and the scenario tell you to prescribe this medication and explain it to the patient. This is one of the station. You may have teaching scenario. They need to assess your teaching ability, not only because one of your rule in the hospital is to do teaching, but one of your rule as a doctor is to teach the patient. What is the meaning of that? To explain things to the patient in a simple way. That's why they assess your teaching ability in the exam. Okay, so but they will bring station related to your colleague, like a medical student want to know something about some examination or some investigation, or a nurse want to know something about some investigation or examination in the exam, and they are limited numbers, so you will manage to know it and practice well on it. And as I mentioned, Simman station. What is the meaning of Simman station? Actually, Simman, it is the mannequin itself, but this is about critical condition. In all Simman station, you will be FY2 doctor on emergency A and E. Okay, so the first point about Simman station will be FY2 on A and E. And we have, as I mentioned, many scenarios, many Simman scenarios, but nowadays it is very limited, like 6 or 7, which is bronchial asthma, anaphylaxis, acute limb ischemia, post-partum hemorrhage, post-hysterectomy bleeding, dizziness. The new one is been after cesarean section, hypoglycemia, confusion because of sepsis. So it is limited number. Okay, so you need to memorize it, and the best way to do it is ABCD approach. Okay. Also, we have many procedure, but most commonly you may find in the exam like blood culture, EBG, IV cannula, Pap smear, otoscopy, okay, subcutaneous injection, catheter, urinalysis, like diagnostic testing. So this is a common procedure. You need to memorize it, and Simman and the procedure, as I mentioned, you need to memorize each step like your name, okay? Because it is not only about passing in this station, it is to gain high score, okay? What is the exam score? Actually, it will be different from day to day, and it is average of the people in the same day. So try to choose day with very weak people to pass, to maintain. Yeah, no one can do it because no one can manage to know people, and it's just a joke. So it will be according to the passing grade, but it is maybe you will have standard variation or deviation about 10 marks from day to day. Some days it will be 95, some days it will be 105. Okay, so in my exam day, it was 107, as I remember. So according to the exam day, some days maybe 90 or 80, like 88, 89, according to your exam day. But believe me, if you apply this out of each stations, we have 16 station, 12 score for each station. Okay, so you need to pass. Actually, only you need to pass. But my advice is don't aim just for passing, aim for high score, because it is yeah, you can manage exam, and you can see, as you see a very huge number of people fail the exam, and even every day I deal with many of them, but I can see that their main problem is they don't know enough about the exam. They enter the exam very quickly, and they don't know. I don't mean by that you need to take 1 year to study. No, You just need to know enough before starting, and after that, start directly. One of the important questions I'm usually asked this question, which is, from where should I study? I think I'm not the best person to give you this advice, because I didn't do any academies, and I use different notes. But at the end, I did my own approach. Okay, so I want you to do your own approach for each station. Okay, because you can't stick to a certain note. Okay, I will study from this ABCD note. Okay, but at the end, I will do my own approach. I will remove some of the question from it, and I will add some. Okay, so try to do this, and I can see that most of people that passes the exam, they did so. For me, I did so, and I used NHS website and the NICE guidelines and patient.info.uk as a very important source for study. Even I did an NHS guide. I think maybe many of you had this book. Till now, it was downloaded like for 35,000 download. I just collected the information. I made it for free, but actually I will add the approaches maybe in the next week. I already edited the book, and I add the approaches for each station, and it will be available after like 10 days from now. It had all the information you need to know from the NHS itself. Besides that, the part you need from the notes. It is not like an advertisement. Actually, it is for free, and you can see it in any group. Okay, but it will be available with a reasonable price after 10 days after this editing. I will let you know. And actually, I usually do discount to help. So it is not about this book. It is about the. I told you I didn't do anything like a secret. I just bring topics from the NHS and the NICE or other UK websites according to the station you may have in the exam. So you can use this station without doing this book. You can use this website in your study, but you need to know how to use it, because not information on this website, you will not need it for the exam. As I mentioned, you are FY2, so you need to know the tasks that you will do and to memorize it very well, and try to remember the name or the headline of the tasks that you will your senior or your specialist will do. But the detail, you don't need to know it. There is no time in the exam, and it is not your role. Okay. About academies, I didn't do any academies actually. So you may ask another one about it, but I used the internet very well. Even one of the funny things in the exam, the first time for me to do blood culture was in the exam. The first time to do it in UK. I don't mean in my home country. In UK was in the exam. I didn't do it before, and I got 11 out of 12 in this station. It was the first station for me, and I just reassured myself, thanks God, I will lose this station, and I will not be in panic, because I predict that I will have another station and another station. So, okay, I had it in the start of the exam, so I'm reassured right now. I will not have any procedure after that. But I did it as in many videos on the internet. I watched the steps and the instrument I have told you, and I managed to do it very well. And also speculum pap smear test. The first time for me was it in the exam, and I did very well. For this is not like an advertisement, but it will help you a lot. This is my website. Yeah, we published the website recently, and we are uploading the videos and literature on it. So great things will come in the coming days. But one of the ready parts here is the procedure part. I made a book for it. Okay, it is a colored book contain all the steps, and also I made a video series for the whole procedure you need to know. This is the videos. So when you book this this procedure, you will gain the access to the book. You will download it, and you can watch the video. There is a discount code. I will share it with you after the mock. Also, there is a man here. Yeah, but don't book it right now. I'm about to upload it. Just a second. To upload it. It cover all the segment, and the PLAB 2 course will be available very soon too. I will update you. Okay. But as I told you, it is not about course or academy or something like this. It is about totally about you. How to do your own approach, how to practice each station. Okay, how to cover as many stations as you can. Okay, so no academy or no course will be 100% successful or helpful for you without your hard work. So you need to work hard on this exam and to do logic steps in this pathway, and you will have a high score. Okay, practice with people who may be in your level or higher. Work on your language. All of us are not a native speaker, so don't worry about your accent or about your language, but try to make it clear. And believe me, step by step, everything will be okay. I think I have mentioned everything about PLAB 2 exam. Also, we do MOOCs, but till the end of this month, I'm fully booked. This MOOCs is one-to-one MOOC. If you are a beginner, maybe after 1 week from starting, you can have one MOOC, and after 2 months, I think 2 or 3 months is enough to do this journey. So you may have one MOOC after 1 week to know what should you do for your first read, not now. So read everything first. Come to me asking me for one-to-one MOOC. This personal MOOC, like the same exam. And after 1.5 months from the first MOOC, had another 1 or 2 or 3 MOOCs. Actually, I started to share this information and to share these MOOCs after trying it with many people. And 1 week ago, I have maybe 6 people who had MOOC with me, passed with high score, and before it, I had many people. Okay, so don't hesitate to ask me anytime. My phone number, you had it, the WhatsApp, and I will share all my publics with you right now. Don't hesitate to ask me anytime. I will guide you. Okay, so I nearly finished the session. If you had any question, ask it directly. And I hope that I covered all what you need. Any question, people? Yeah, sure. And I usually do like a session maybe every week. We used to do it every week, but because I have a lot of work right now, so I'm trying to conduct it as I can. Okay, and people, let me reassure you, I went through this journey, and believe me, for me, it is not about money at all. Okay, I give help. Yeah, we have paid services. You know, all of us have families. We need to accommodate them, but also I understand the situations. So don't hesitate to contact me anytime, and I will give you the guide you need. Okay, and wait in the coming days. I will publish a whole course. It will be a detailed course for each station, how to do this station, maybe the model answer for the station, and also for the man. You are welcome. Let me share the groups with you. I think three focused months is enough. Okay, some people take more, but if it is focused study, I think it will be enough for this exam. Okay, this is the link for the website. This is the link for the procedure part. It's available and its book is available. After 10 days, the whole course will be available. And let me give you the discount code. It will give you 50% discount. Yeah, I will update you. The book will be available. Actually, it is very good book, and it is good because it is from the this is people. This is the code for the procedure. It is available for 50% only. Okay. Yeah, I will continue. Yeah, study. I will continue. And I will do mocks. But you know, we have Ruta in the hospital, so I'm not available all the time. But I will try to do my best. This is a discount code, and it is available for 50%. Okay, it will give you 50% discount on the procedure, and it will be available with you till the exam. If you face any troubles on the website, or if you stuck in anything, just contact me directly. Just 1 minute, and I will share with you the all my publics. You can see we have a lot of WhatsApp groups, because you know many people had different exam time, so we do groups from time to time, and the group is limited number. So the main way to access information is Facebook and Telegram group. The Facebook group and Telegram group. I will update you about each session. Mostly we do a session each week. Okay. Sometimes we do a group mock. It is for free, away from the paid one-to-one mock, and sometimes we do a session to explain some things. Okay, so till now, any question? This is all my public. Let me share with you also my WhatsApp number. Yeah, this is a good question. Myself, I know I deal with people who had 7 years gap from medical practice. This is a very good question, actually, and they passed the station from the first attempt. I know many people. I'm not saying this to reassure you, but I actually I have seen them in real life. They managed to pass the station. So it is about what you should do. If you passed yesterday, if you just graduated yesterday, or even if you graduated 10 years ago, because you need to pass through the same curriculum. Okay, all of us need to pass through the same pathway to reach the end, even if we graduated from 1 year or 10 years. So not having a clinical experience, it will not make a difference in your performance in the exam, or having a clinical experience for 10 years, it will not, unless it is in UK, it could make a difference. Okay. Actually, it is a Dr. Siren. It is a difficult question to answer. How many hours a day? It is different from person to person, but maybe at least 3 hours a day. At least 3 hours a day during these 3 months, at least. Okay. According to your situation, if you don't manage to do it, you may extend the period. If you are not able to book the exam right now, so yeah, it is a very good chance to pass the exam from the first attempt. So study every day, but just put a regular schedule for your study. And again, people, don't hesitate to ask for help, because I know that it is very easy to pass this exam, and I know also it is very easy to fail this exam. So I don't need you to have this experience. Just do it from just first attempt and do it with high score. Okay, people, thank you for attending the session today. I have to go right now because I had the mock after you. And if you had any question, just leave it on my publics. Okay, see you soon.